Hi, this is Jessica DeMassa with WTF Health. I am here with Ari Tulla. He is the co-founder and CEO of BetterDoctor. So Ari, last time I talked to you was like 2 years ago at Health 2.0. So what have you learned as a startup in the healthcare industry in the last 2 years?
2 years is not a long time in healthcare. That's the key learning. You try to do something quickly and break it and rebuild it. But in 2 years, really, what we're able to find is that healthcare has found some certain issues that we really care about that are becoming a hot topic.
Okay.
2-3 years ago, people kind of saw the need. Now it's becoming a topic that people really need to do something about.
Okay, so what do you mean? Like, what are you referring to?
I'm referring to what we do. My core business is to help people find the right doctor. We do that by trying to give accurate information about providers, doctors, to everybody in the ecosystem. And that's a need that has been there for a long time, but in the last few years, the health plans have had a mandate to do this. And mandate means that the regulators are saying that, hey, you have to get your directories accurate, otherwise the consumers are going to go to a doctor that is not covered.
Right.
And they get a bill at home that will not be $30,000 or $30 copays, but $30,000.
Right.
That should not happen, and that is now changing the mindset in the health plan space. So it's really, I think, a good movement, and I'm super excited.
That's fantastic. So what kind of support are you seeing now from health plans as they're trying to do this? And do you think like AI, like the further integration of AI into this space is having a lot to do with it as well?
Well, I think we talked about, a couple of years ago about, BetterDoctor being a data company. We work in data science. We try to do machine learning. We try to understand patterns. And we found out in the last few years that, you can't really do machine learning if you don't have the base data set to learn from.
Right.
It is alchemy. It's impossible. So we basically said that we have to go to hand-to-hand combat. We have to talk to doctors, providers, and collect the data from the source. Half the data had never been collected, so we couldn't really invent it from the thin air.
What's been missing? Like, what data is not being collected?
So we work really on the basic stuff. Think about when you go to a doctor, you need to know who are they, where are they, how to contact them.
And that's missing.
Are they in your network? Some of that data was missing, like fax numbers. But if you think about the more valuable stuff, like affiliations, we need to know how people are affiliated to each other. We need to know if a provider is accepting new patients. It doesn't, help to call if they already are booked for the next, few months. And then, you have a lot of other data, like, opening hours. Things like ADA accessibility. What if you have a wheelchair? How do you get in there? There are some practices that have a narrow elevator in New York that you can't get in with a wheelchair. That kind of sucks.
Yeah. So, why is this so hard to figure out in healthcare? Because it's like I can Google something and it will tell me, like, on my way there. I'm not even in, I'm in directions and it will say, this might close in an hour. But why is this so hard to figure this out in healthcare?
Well, I think, I would bounce that question to my colleagues at Google. If you go to Google today and you ask them to help you on this problem, they can't do it either. Google information is inaccurate. The problem really in this space is simple. Healthcare is collecting data, huge amounts of it. But we are collecting the data for billing purpose. Mm-hmm. If you think about this, claims data, we are seeing billions and billions of claims a year, and that data has, of course, information where was the patient seen. But that data is not reflecting to the visit address, it is reflecting to the billing address. Okay. So you get these billing addresses, billing phone numbers, and another point is that you have systems like credentialing. Every provider has to be credentialed by health plans every 3 years. Every 3 years is way too infrequent because data is changing 20% year on year on providers. Oh, so in 3 years, 60% data will be inaccurate. So we've never really been focusing on this from the perspective of the patient experience. We always look at everything from the billing perspective, and that is causing a lot of havoc, not only in my turf, but almost in every area where you have data. It's unstructured, tough to use, because the data is for the billing purpose.
I think that's really well said. And so, shifting it to the customer and focusing on the data from the customer perspective, how has that helped you at BetterDoctor?
I think now it's interesting because we mainly work with the health plans, and we have a lot of customers who come to us because we need to get the compliance done. And health plans are very reflective if there's a compliance question. There's a new law, you have to do something about it. But really when you talk to management, they are saying that it's great that we have the compliance need because now we can also focus on the key point we have, which is the consumer experience. Every health plan today is thinking, and every C-suite in health plans is thinking about what do we do not to be disrupted by the Amazon, and you can name the next flavor tomorrow. God, right. And you have to do that. And I think that's amazingly good development because finally people will do changes. And if you have a driver from compliance and then you have a need of maybe existential risk of building a better experience, I think the consumers are going to benefit a lot in the next few years. And
That's
also,
so
by the way,
exciting.
and there's also, of course, when there's a need, there's an ability for the startup community to build, I think, tens or hundreds of new companies who can help do that.
Last question for you. So we ask everybody about, WTF health. So, and that means what's the future health? So it's like, what's the future you think in this space? I mean, there's a lot of like little companies working on getting this provider data stuff sorted out. So it's like, what's the future hold? Like 5 years down the road, what are we going to be talking about?
I think in my turf, this is an issue that has been there for 30 years. So there was a printed directory of doctors that was delivered to members, thousands of pages in New York and LA. So from there we went online. I think we will be able to fix this problem in 2 years.
Do you really?
I think this is going to be going away because this is not a hard problem to solve. It has been done in other verticals many times over. But really in 5 years' time, I think we're going to talk about first of all, I really want to see the member idea go away. Okay. We are not members, we are patients, and we really are consumers. We need to be able to leapfrog the experience to a level that we have every day in our lives. Mm-hmm. You click a button on your Uber app, the Uber comes in 2 minutes. If it comes in 10 minutes, you complain in Twitter. Amazon, you order a book on Amazon if you order books anymore. You click the button, you get it the next day.
Right.
They say, 3-day delivery. They're going to provide it to you tomorrow, 3 times faster than they promised,
right,
for free. That's happening today, and at healthcare, we can't get the basics right. We have to get the basics right, and I believe in 5 years' time, we have to do that, or there will be other players who will show us the way. And then I think that is opening up a huge platform for innovation, because we need to do matchmaking. We need to do stuff that will make us healthier, not when we are ill, but before we get ill.
Right.
Prevention. We need to focus on these things that really matter. Eating better, sleeping better, exercising more. Those are the things we need to focus on. Half our money, now we put maybe 2% of the money in those problems.
What do you think? Is there like a silver bullet for you? Where is there like any technology or whatever that you were really excited about that you think is going to leapfrog us there in 5 years? Because I talked to you 2 years ago and you said it's a long time, 2 years. So 2 years plus 3 years, I don't know, Ari.
I think it's all about healthcare as an industry is all about data. And today, we had a panel a moment ago, we talked about orchestration and cooperation and collaboration.
Yeah.
We will not be able to do these things if we don't move the infrastructure in the cloud. That's the first step. We have to be in the cloud. If you are in a server in a basement, nobody can talk to that.
Right.
Let's go to cloud first. Let's then break the silos, the data silos. There has to be a security, of course. We have to be the cognizant of the patient's, data is secure and safe.
Yes.
But we can do that in a way that there will be a better place where the data can move freely. Patients can own their own data. And at that moment, I think we will look at things like blockchain, where there will be a new technology in place that will enable this to be done securely in scale and in a collaborative manner. If those happen, then we're going to be in the same space as any other industry, and they're light year ahead. We will be light year ahead once we get those basic building blocks right first.
Well, let's hope so. Let's hope so. Here's our fingers crossed. I hope I get to talk to you again sooner than 2 years. But in case I don't, we'll see if these predictions come true.
Cool.
Ari, thank you so much for joining us. This is Ari Tulla from BetterDoctor, and I'm Jessica DeMassa with WTF Health. Thanks for joining us.
Okay, thank you.